areas that can't even be reached via vehicle. We also have this problem. It affects us in terms of education, but it also affects us in terms of access to healthcare. And the other thing is sort of policy and legal loopholes that we can advocate for. So I think the most popular disaster that has happened that required an emergency response was in Lagos, when the building collapsed and 44 people, I think maybe even went up to 50, eventually died. And again, that was an issue of perhaps there being ways that people could move around the system and perhaps do things that were unsafe. We don't know that to be the case yet because the people that are sitting on the board have not come out with a conclusive report about what happened, but I put that there just as food for thought. But what we can sort of conclude is that, next slide, emergency skills do save lives. And it's not the emergency skills of only doctors and nurses and paramedics, it's emergency skills of normal people. Like I said before, states where normal people know how to save lives have better survival statistics than states where ordinary people, this is in America, where ordinary people aren't trained how to save lives. So the best response, even if you're not a doctor or a nurse, actually the bystander response, the lay person's response, the response of the person that's not a doctor or a nurse or a paramedic really matters in terms of emergency skills. And it matters at work. And we are all sort of talking about emergency response from a work perspective today. And the conference, I guess the theme of the conference is centered around our emergency response skills at work. But I think it's important to also think about emergency response skills at home, where a child is choking, for instance, or a child has an asthma attack. These skills that we're learning for the workplace can also be useful in our homes and in our third places, places of worship, social clubs, etc. So I'm going to talk briefly about the work that the Flying Doctors has done in Nigeria and across West Africa on the next slide. So the Flying Doctors Nigeria was started in 2011. I actually stepped down from running it in after 5 years, so I'm on the board of the air ambulance now, but I don't run it anymore. But what I do know is that I can tell the story of how it was founded, and because I'm on the board, I can tell the story of what they're doing now. Next slide. So in terms of numbers, the Flying Doctors has responded to 5,000 evacuation calls in over 80 countries, mostly in remote areas. We've broken over 3,000 patient consultations at our hospitals and clinics. As a group, with the Flying Doctors included, but also the other companies that we've invested in, we've created over 1,000 jobs and executed on 2 hospital projects. And I'd like to talk about the types of evacuations we do. We do national evacuations within the country. So this is between different states, from states or areas that have low levels of healthcare to states with better healthcare. We also do regional evacuations. And sadly, when we look through our statistics, even within West Africa, we don't see a flow of patients coming in to Nigeria from other West African countries. They prefer to go to Senegal, they prefer to go to Ghana. So even in West Africa, when we're moving patients from one West African country to the other, Nigeria is the biggest economy in Africa. Nigerians are seen as the richest people in Africa. The richest man in Africa comes from Nigeria, but when people are choosing their healthcare destinations within West Africa, Nigeria is hardly ever a destination. But we do regional evacuations, for example, from Burkina Faso to Accra, or from other areas of West Africa into usually Accra, Senegal, to be honest. And that just shows that, we have some work to do in terms of our emergency and acute medicine in Nigeria. And then we do international evacuations from all over Africa to different countries. And why air ambulance? Why move people by air? Why not just move people by ground? A lot of people need to move from, say, Maiduguri to Abuja or Maiduguri to Lagos. That would probably take about 14, 15 hours by road, which would be logistically impossible. When people need to move over large distances in a very, very small space of time, when people that work on offshore rigs, for instance, need to be repatriated to a large city from the offshore location, when people work in swamp locations, like I'm sure many people in the oil and gas industry do, where there are deep swamp, shallow water activities, then people need to be evacuated in a timely fashion from those remote areas to an area where they've overwhelmed, the level of care to a more suitable level of care for them. And next slide. What we're always aiming, this is our aircraft, and this is moving actually a premature baby into the aircraft. That team are moving a premature baby into the aircraft with an incubator. What we're always aiming to do is save lives by saving time. And moving people usually to national, regional, or international centers of excellence. Next slide. So what can we do to improve? What can we do today to do our part in terms of making the healthcare situation, particularly in the area of emergency response, better? Number one, like I've repeated quite a few times in this presentation, learning first aid skills, learning emergency response skills, which I'm sure some of what will be taught today will be around emergency response. The basic idea of airway breathing and circulation, and understanding that these are sort of the linchpins of saving lives, and how to check an airway, how to ensure somebody continues breathing, and how to improve their circulation. In the event of a cardiac arrest, how to either give a manual response, a manual defibrillation, or use a defibrillator, or use an automated external defibrillator to try and get the patient back into a survivable rhythm, heart rhythm, are really important. So basic first aid skills are things that we can learn. Number two, also engaging with Medivac, emergency cover, insurance cover for our companies to ensure that no matter where we're working in Nigeria, whether it's in mine locations, whether it's in swamp locations, whether it's in the construction industry, that we're covered for emergency services and we have emergency response. And then get family members trained as well, because I said that these skills don't or even though the theme of this conference is about emergency skills at work, we shouldn't forget that we have families, we have home-based emergencies, so getting family members trained as well is really important. And also as citizens, I think the role of advocacy is really important as well. So speaking about it to our local representatives and letting them know that it's something that's important to us, to have emergency services. I can remember when I lived in England and a political candidate wanted to stop or reduce the amount of money going towards the National Health Service and our emergency services. Of course, that candidate could not get passed. No candidate that touches anything to do with healthcare gets very far in the UK, because healthcare is the number one issue that UK citizens use to vote. In America, when we're all watching television and talk, healthcare is one of their number one issues, whether it's Obamacare, whether it's Trump care. Every politician wants to talk about healthcare because they know that it's important to citizens. With elections coming up again this year, what are we going to be talking about? What are the issues that are important to us? And if these are important to us, then these are the issues that we should be talking about as well, and let our representatives know that this is an issue that is important. Last slide. In conclusion, we've learned that the current situation for healthcare, particularly emergency healthcare in Nigeria, is extremely poor. And that was sort of the initial sort of statistics that we looked at. I spoke a bit about what Flying Doctors is doing in the emergency response space, but I think the most important thing that I spoke about was also what we could all be doing to try and make emergency response better. And I spoke about the importance of emergency response and what we could all be doing to influence emergency response in Nigeria and make it better as well. Thank you all for your attention. I hope that this was a helpful presentation, and I'm open to any questions before I catch my flight.